Hello and welcome to the EduTalk series hosted by Biotone EduPartner Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Dr. Cynthia Price, a massage therapist researcher at the University of Washington and director of the Center for Mindful Body Awareness. She developed an evidence-based approach to mindful awareness in body-oriented therapy to teach interoceptive awareness and address bodily disconnection frequently seen among those with trauma, pain, and addiction. Let's listen and learn as Cynthia discusses how interoceptive awareness involves attention to the internal body sensations, both physical and emotional, and is critical for facilitating self-care and emotional regulation. Cynthia will explain how to help clients increase their capacity for interoception with important considerations for your practice. And we have a lot to get to. Thank you, Cynthia, for joining us. And again, everyone, please have sound muted and video off. And I'm turning it over to you, Cynthia. I'll see you at the end of your presentation. We'll answer chat questions then. And it's all yours.
Okay, thank you so much, Donnell, and thank you to Biotone for hosting these EduTalks, and to all of you for joining us. I'm going to share screen so you can see my slides here today, and hopefully everyone can see those okay. So as Donnell mentioned, I'm a research professor in the School of Nursing at the University of Washington. And before that, I was in private practice for 20 years as a massage therapist. And it was in the course of my massage therapy, working a lot with people who were in recovery from childhood sexual abuse mostly, who are very disconnected from their bodies, that I developed an approach that I now teach and research, and have been doing so for the last 20, 25 years. So I'm going to tell you a little bit about what interoceptive awareness is, about a little bit about the approach that I use and the research behind it, but also really want to talk about why it's helpful for body workers to think about incorporating this type of work in their practice, and to answer any questions you might have about that. So to start, let's just, oh, this works a little differently than I'm used to. So body awareness, hopefully everyone, if you cannot see this screen, this isn't moving the way I'm used to it, but I think you can see what I see. Body awareness is an umbrella term for any kind of body awareness. So we're just talking about sort of some definitions here. So it's probably a better term for sort of talking about being aware of the body, right, than this fancy term interoception that a lot of us still are unfamiliar with. But the difference is that body awareness incorporates all types of body awareness, and interoception is focused on internal sensations only. So it's not so much focused on sort of the proprioception in the sense of movement through space, but more internal sensations and our awareness of them. So interoception is a term that really wasn't used in our field until maybe 10 years ago or so. It's really grown as a term that more of us are aware of, who are involved in any overlap with mindfulness. And I'll tell you why I think it is an overlap with mindfulness in a minute. But it means on its own the processing of sensory input, much of which is unconscious, and it serves to just help us be more regulated in all the ways that the body needs to stay in balance. So having that sensory information come up into the brain for regulation is what interoception means. But when we're talking about the term for awareness, it's the part that's conscious. And that is about how we bring our attention, our internal attention, into the body to notice what we notice inside. And when we do that, it activates an interoceptive network, which primarily involves the parts of the brain that are indicated here, which is in the insula. And this work has been very developed initially by Bud Craig, who traced the sensory pathway, so he knew which part of the brain was primarily involved in regulation and processing those sensory inputs. And Norman Farb, who is somebody who is in Toronto, a neuroscientist who's done a lot of work clinically with looking at interoceptive awareness. And I've done some research with him. So when we talk about sort of how did this work get even associated with body work, for example, it's really out of the mindfulness world, trying to understand how mindfulness meditation works and realizing that these sensory inputs are really play a role. Whenever, if you've ever been to a mindfulness class, one of the things that people get introduced to is the sensation of the breathing process, right? Of us inhaling and exhaling. And when we do that, we're engaging interoceptive awareness. We're feeling the sensation in our body, right? And so when we work as body workers, we can always help our clients kind of tune in to what they're feeling internally. And if we do that, that's helping them be more aware of their interoceptive experience. And we're going to talk about why that's important. But kind of turning back to neurocognitive research, as I said, the insula supports a lot of the processes of taking in the sensory information and then using it for regulatory purposes. So knowing how we feel physically and knowing how we feel emotionally are really basic. That level of awareness for emotion regulation, for managing physical discomfort or emotional discomfort. Just like it helps with manage other pieces of staying regulated, like other aspects of staying regulated, like knowing you're hungry and you need to eat, knowing you're cold, you need to be putting on more clothes, knowing you're tired, and that you need to go to bed. So all of those things are regulatory kinds of things that involve sensory information. So there have been quite a lot of studies in the last 15 years that have looked at, using fMRI, looked at imaging and noticing where in the brain and if the brain is really lighting up and processing sensory information. And it's very clear that people who are struggling with mental health disorders, chronic pain, high levels of stress, all have a reduced processing of sensory information compared to people who do not struggle with those kinds of things. So what this tells us, right, is that there's a shutdown effect that's happening where folks are not paying attention internally and processing the information that might help them regulate better in their lives. So because all mental health disorders, for example, across all of them, there tends to be a difficulty with emotion regulation. It's very, very important that when we're working with people, body workers work with people who have pain all the time, different kinds of pain all the time, right? That to help them, help our clients help themselves, the more awareness they can have of their internal experience, the more capacity they have to help regulate themselves. And so thinking about ourselves as massage therapists who are also educators, who are also sort of supporting people to have more skills for self-care, is sort of the perspective that I come from, and what guides my work, and why I want to talk to all of you is there's so many ways that you can help your clients learn these skills so that they're more able to take care of themselves, and that involves this kind of awareness. So I was talking earlier about mindfulness, and mindfulness is defined as present moment awareness with an attitude of non-judgment and compassion for yourself. And I really do think that in order for folks to really attend deeply to their internal experience of their body in their bodies, it does involve present moment awareness. So in that way, it is a mindfulness. There's mindfulness involved in really paying attention internally. And so I think there's a lot of overlap between mindfulness and interoceptive awareness. I'm also aware that for people for whom this is a very unfamiliar concept, for people who have developed a lot of coping strategies to protect themselves from their pain, just get through the day, whether it's emotional pain or physical pain, which is a wonderful coping strategy that human beings have. At the same time, it can really lead to a lot of lack of awareness of what we also call experiential avoidance. And so folks may need a lot of help learning how to shift to their patterns of coping with pain, physical or emotional pain, and be in a position that they can really feel comfortable bringing their attention more deeply into internal awareness. And we see that people who go to mindfulness classes for whom this is a struggle or brand new, or their own automatic kind of coping patterns are really well developed, that being in a class situation doesn't really help them learn these skills. That a lot of times individual coaching is necessary. And so the one-on-one work that we do as body workers, and also other folks in other disciplines, whether they're in psychotherapy or occupational therapy, physical therapy, whatever, I think that there's a lot of need for really developing the skills for how do I help my client learn to do this better. So the individualized coaching, I think, is really important. And the work that I do is based on that sort of model. You know, it's a one-on-one process where we're teaching someone to develop their capacity for interoceptive awareness. And we use touch, we use psychoeducation, and then we use mindfulness. So the touch piece can be incorporated into body work. And that's how we do our research, is we hire massage therapists. I hire massage therapists and train them in this approach called mindful awareness and body-oriented therapy, which is really designed specifically to teach people fundamental skills of interoceptive awareness for their own self-care. But this work is been designed, you know, is used right now in research where it's an 8-week intervention, and we go out to clinical situations and teach it. But when we're teaching people in the community who are in private practice, it's like anything you might learn. You can integrate it into your work with your clients however you want and seems to match how you work. It doesn't have to be done in sort of a 8-week protocol. But that's what I'm going to tell you a little bit about in terms of our research. And so let me go to the next screen. So MABT, which is what the acronym is for Mindful Awareness and Body-Oriented Therapy, has 3 different stages where we're teaching people sequentially how to actually engage and learn how to connect internally. And we start with what's called body literacy, which is really developing language to articulate sensory experience. So our first 2 sessions are really focused on this type of work in an 8-week program, therapeutic program that we do in research. And we incorporate it into massage. So as someone's getting a massage, we'll pause in a place where there may be some sensation. It could be a physical nod or tight holding, someplace like that. And pause with pressure and ask someone just really simply, how would you describe what you notice right here under where my pressure is? And we're helping the person, we do that throughout the whole body, helping the person to really notice their sensations and to find words to describe their sensations. And we work a lot with folks who really haven't had much body work. We work in our research with very low income folks who often haven't had any of this kind of care, but are struggling with mental health disorders and or chronic pain. And so developing a vocabulary is what we're working on. And that's really not interoceptive awareness. It's really having more awareness and words for sensations so that as we move into developing interoceptive awareness, we have a language that we can share together as a therapist and a client. So the next two sessions are really focused on how do you bring someone into their body so that they can learn to feel internally. So that's like the example I gave earlier. When you go to a mindfulness class, there will be this introduction to interoception, which is about just feeling the sensation of the inhale and the exhale of the breath. That sense of expansion as we inhale, that sense of the diaphragm moving, right? All those things. So we work with different strategies for helping someone to actually feel inside. And then the last four sessions of this program are really focused on learning to have more of a mindfulness piece, which is resting one's attention in a very specific region of the body. So it's developing the capacity for sustaining attention. And what happens when we do that is, like, say I bring my attention down into my chest and I'm just resting my attention internally in my chest. If I can stay there for quite a few minutes, right, I'll start noticing more and more about how I feel in that region or what I notice in that region. And then that region will likely start to change. What I notice inside will likely start to change, whether it's a physical thing or a visual thing, whatever it is I'm noticing. And this leads to people having a better understanding of what is going on for them in that part of their body. And they often come out of sort of this meditative state of being in a specific region of the body to say, oh my gosh, I never realized that I had so much stress there. And that when I pay attention in that part of my body, it just starts to go away. Like I start to feel a sense of openness inside, like it's a new experience for a lot of people, right? And those kinds of things are very, very empowering. It's like, oh, I want to feel more of that, and developing that sense of the body being a place that's enjoyable to be in, or that has information that, someone may come out of this meditative place inside and say, oh, I'm feeling so sad. I didn't realize how sad I was feeling. And I'm realizing that I've been having this conflict with my partner, and I didn't know I was holding that in this part of my body. And now I understand why I've been having this heaviness in my chest, right? It's making this connections that often happens, but it's by spending time there that those things happen. And that's what the appraisal word is about here. It's like having some new understandings of oneself that comes from this more somatic experience, you could say. So that's what this work is about, and that's why what we do as body workers, it sort of facilitates it. When we're doing this work, the first stage, we're stopping and pausing in the context of massage therapy, but all the other teachings involve hands. So, like, for example, in this last section, I would be sandwiching the chest as a therapist. I would have a hand on the front and a hand on the back to guide someone's attention into this area of the body, and then holding that in a gentle but firm way, so that if they start to mind wander, if they start to thinking about the grocery list or the argument they had with, their partner last night or whatever, it's a way to say, oh, come right back here in this space between my hands, right? It's a very, very helpful. Our hands are very, very helpful for helping somebody bring their attention into a very specific region of the body. And that's why this work works so well with bodywork and so powerful for teaching it. So as was mentioned, I think, by Donnell in the introduction, this work is extraordinarily helpful for people who are disconnected from their bodies in some way. And it's really working on helping to address that. And the ways this shows up in the most really basic ways is often a lack of physical awareness, like where I am tense, a lack of emotional awareness, a lack of awareness of the link between the physical sensations and emotional sensations. So it's often very fundamental very fundamental things, but they're very powerful if we start to pay attention to them and learn about ourselves and from this kind of approach. So I'm not going to spend a lot of time talking about my research in this region, but I wanted to tell you a little bit about the kinds of research I've done. All of these studies are accessible. So if you're interested, you can read more. They're available publicly through PubMed, but they're also available on the research link on my website. If you open that up, every single article I've ever written about this approach or related to this approach, the article is linked there. So I've done a couple randomized control trial pilot studies for women in recovery from childhood sexual abuse. I've done a randomized control pilot study for people living with HIV. I've done a phenomenological study, which is really focused more on its qualitative method to really understand the process of this work. How is it that the unfolding process of learning this seems to take place, right? What seems to be most important for that process? I recently published with my collaborators 3 papers related to the first neuroimaging study of this approach in just the last 6 months, which was really exciting because even though it was a pilot study, it's the first study showing that there's plasticity in the brain, that we can really train people to develop their interoceptive awareness, and we can see more interoceptive processing. So even though there have been quite a few mindfulness studies in this realm, this is the first study that's actually shown that. I've done quite a lot of NIH-funded, that's the National Institute of Health, funded studies in substance use disorder. So this is for the first couple were with women who were intensive outpatient treatment. And right now I'm just finishing up a very, very large study for men and women who are on medication for opioid use disorder. So have worked a lot in this realm in community-based services for people. And then I've done a couple of studies that have been more focused on chronic pain. One was done quite a while ago for female veterans with co-occurring PTSD and chronic pain. And then there's another study that just got completed for people who were, it was a pragmatic trial, which means that we were really working with massage therapists who were already staff in a clinic, a chronic pain clinic, and looking at 2 things. One was from a more systems level, how was bringing MABT into their clinic as a new service received by the clinic? What did we have to do to help support that? But also looking at how the clients who received this approach, their health outcomes, and they were pretty wonderful outcomes. But so this hasn't been published yet, but the study is completed. So these are just kind of overall across all studies. What can I say about this type of work? That we see significant increases in interoceptive awareness. People really do learn what we're teaching them. We see significant reductions in mental health distress, significant improvements in emotion regulation, and significant reductions for those who were in substance use disorder treatment in substance use and craving for substances. The other thing that we see, which I think is really important, is continued use of these kinds of approaches in people's daily lives for their own self-care. So when we're doing these large studies, people are in the study for a year, 9 months to a year, and we're following them long after they've received those initial 8 weeks to learn these skills. And then, but we keep asking them about how they're doing and whether they're using these skills. So that's how we have this data, and it's very powerful to see that folks find it so useful to learn these skills that they keep practicing them on their own on a daily basis a year out, which is probably why we see this level of a positive response. And I think what it speaks to is that oftentimes, especially for people who haven't had a lot of skill or knowledge on how to pay attention to their bodies, how helpful it really is for them, right? Like they really didn't know how to process their emotions before, but just by learning to pay attention to how they feel inside and realizing that helps them be more aware of how they're feeling, then they feel like, oh, I have this thing that is like so great. I can use it every day. I can do it before I go to sleep. I can just pay attention internally to how I'm feeling, or while I'm washing the dishes, or while I'm driving my car. Like, right? It's turned out to be really cool to see how much that's the case. We also always ask people qualitatively what was really important to them. What did they learn? And these are the kinds of themes that we consistently hear. That there's an increased awareness of bodily self, which of course is what we're teaching. But here's some examples. I had tuned out of the rest of my body. Now I check in with my full body. Or someone else wrote, I'm more in tune with different parts of my body and can tell where I experience sensations. Another theme is that link that I was talking about earlier between physical sensations and emotional experience. So someone wrote, I have connections between cravings and where they exist in my body. Or I learned to connect mind, body, and spirit. This is the turning point to freedom. And people really, really identify how much they're better able to self-regulate. So here are some examples. I learned how to relax and calm myself. Another person wrote, I can put myself in a place that's peaceful. It's helpful and relieves tension. Someone else wrote, I can use emotions versus having them use me. And lastly, this work gives me coping skills when I'm in a stressful situation. And then very importantly is this idea of acceptance, right? We're working more with what emerges from the body just naturally when people start to pay attention versus trying to fix something. And so this idea of really, which is also a mindfulness quality, is of acceptance. So I learned to listen to my body, not fix it. I learned to just let them be, talking about feelings, and to honor my emotions, even if they are negative. So just giving you an idea of what people find really helpful about this type of work, because all of you are probably here because you're thinking about these kinds of things yourself. So I've been very involved in the development of scales that are designed to measure interoceptive awareness, or awareness of internal body sensations. One of them is called the Multi-Dimensional Assessment of Interoceptive Awareness, or the MAIA scale. And so when I say we're seeing that people are better able to emotionally regulate, they're learning interoceptive awareness skills. This is a scale that we're talking about. It's got many subscales, and these are the kinds of things that it's measuring. Noticing, having awareness is the noticing scale of sensations in the body. Attention regulation, which is the ability to control attention to body sensations, to actually maintain that attention. Awareness of the connection between body emotions and emotional states that we were talking about earlier. The ability to regulate distress by attention to body sensations. Actively listening to the body for insight, which is the body listening scale. And the experience of one's body as a safe and trustworthy resource for oneself. So just so you can see, here is the change on the self-regulation scale of the Maya, and the kinds of things that are on the right are the specific items. And that those who got MABT have this increase from pre to post of the program. The 0 to 3 on the bottom relates to baseline and 3 months later, compared to the other 2 groups that were in the study who did not receive this program. So just when we talk about, well, you know, it significantly increases what we're talking about as people are showing in terms of how they respond to this survey or questionnaire, that they really are able to do and do these kinds of activities on their own and at a different level than they did when they came into the study. So as I said, one of the most impressive things about doing this work has been noticing how often people continue to use these skills long after they learn them. We did a study many years ago where this is the first time I had seen how strong this was, to ask people, you know, what motivates your continued practice and what are you actually doing? And this is a really common response that we see in our research, which is, and I'll read it to you. You're not hiding from things inside you anymore. I think that had pretty much to do a lot with my use. This is substance use. I was trying to cover up feelings, trying to cover up emotions, and it was how I coped with life. MABT gives me the ability to focus on things in a different way, you know. It's a very unique way to think about things that are within me and connect my body to my mind and spiritual duality, and being able to connect to everything inside. So this is a very common sort of theme that we hear about why people keep practicing, is it really helps them have this place, this skill set really to know how to pay attention to how they feel internally. The current study that we have now with people who are on medication for opioid use disorder, these are just also some little quotes that came from a couple of the folks in this study that I'll share with you. One woman, 31 years old, Native American woman, said, I learned to listen to my body and really feel my emotions and was able to recognize how they were related. I came in with a horrible back pain, which caused headaches and a lot of discomfort, and now I have none of it. It was all from tension due to stress. I can sit and feel my emotions and sit with them and not have them control me, as well as find and release negative energy in my body. I used to lash out or stay in bed on bad days I didn't want to face. Now I can talk myself through those days. I feel so much happier and truly feel I can say I love myself now. It's a beautiful, beautiful quote. And this is a 68-year-old man, African-American man, who wrote, I learned to relax the whole me. When I am relaxed, I am more at ease and ready for what is next. Once I feel relaxed, I feel like I want to do something, like get on my bike and walk. It makes me more aware. I never really was in touch with my emotions before, and the therapist showed me different ways to recognize and deal with them. I am more aware of what I am doing. It makes me stop and think, do I really want to smoke right now? Do I really want to drink right now? Now I'm able to sit or lay down and use MABT practices to respond to pain and discomfort instead of using medication. So, you know, why help your clients learn to develop their own interoceptive awareness is really these kinds of things. Having more capacity for self-care and awareness, to access and trust their bodily cues, right? Like you have to have that internal awareness in order to know what needs attention, to manage daily stressors, to manage chronic health conditions, to have more emotional balance and wellness in life, and to engage in more healthy behaviors. So when we talk about therapists learning these skills and integrating them into practice, these are some sort of overarching things that are going on that I think are very important just to say them. It's an invitation for your client and yourself as a therapist to really be in presence around what the person is experiencing internally. It involves a guided instruction process, a focus on internal experience. The pacing is kind of more slowed down in matching the learning process of a client. It involves both the client and the therapist being in awareness and noticing what is emerging. So it's a really unfolding process that is very collaborative between the client and the therapist. And what supports teaching this? Like if you were going to incorporate more of this kind of work in your practice, what supports doing that? And what supports your client learning these skills? And these are some basic, again, sort of kind of high level issues, but they're really important ones. We individualize how we teach this to match the learning needs of the person we're working with. So just working really collaboratively with them, as I've said before, that it involves a fair amount of trust and sense of safety in the therapeutic relationship. And I consider this approach to be trauma informed for that reason. We're really working on having the client really be in charge of how things move forward. The therapist and provider, as I mentioned before, are in a state of self-presence, each of them, and connecting together around developing a deep sense of presence in the body of the client. And comfort. It's really important for a therapist to be bringing this kind of work forward to their client, to be really comfortable in teaching this work. You have to know how to do it yourself. So when we are teaching body workers and other therapists how to really learn this approach so they can integrate it into practice, we're working a lot with the client, with each therapist really knowing how this feels in their body and having those skills, because if you don't have those skills, as I said, it's very hard to teach someone else. And that we're really following the client's process. So those are kind of my big ending takeaways, and I wanted to just have some time to answer your questions if you have any. So I'm going to stop sharing here, and I don't know if people put something in chat, but Janelle will help with
Yes. Excuse me. We have a few chats, and we still have time, so feel free to chat your questions, your comments, your experiences that Cynthia will take time to address. And Patrice, early on in today's presentation, said she loves this type of work and incorporate lots of breath work with my clients for mind-body connection. Now, is that an easy, I mean, the therapist actually has to go through a whole understanding process of this with you, but the breath work seems like it would be an easy place to start.
Yeah.
Just
Yeah,
getting you in tune with your client.
Absolutely. And we work with breath quite a lot for helping people to really start feeling that sense of how do I get into that sense? What are the sensations inside my body, not externally, like this person massaging me over here on my, on the top of my shoulder or down my arm. We're working with that too, but that's external. So to get internal, yes, we work a lot with breath in order to do that.
And Akai, I think I'm pronouncing his name right. I came to see that I put myself through this entire process when my changes took place. Being an Army veteran, I have been to war and I've done terrible things to later have to conquer. Is there a way to implement this process with veterans in a larger group?
Yeah, I don't know, Kai, if you're working in a group, you're welcome to unmute yourself and chat some more if you want about this specifically. So I worked at a VA at one point and did a pilot study for female veterans with chronic pain and PTSD. I think this is great work for veterans. There's providing it at a group setting would be quite different, but I think that many of the aspects of this approach could be translated into group work. It would be different, but I think it could be done. So if that's your question, I think the answer is yes. But mostly, I really get it. I mean, going through any kind of violent exposure and recovering from that is huge, and we do hold those experiences in our body, and this kind of work is extremely helpful for that.
And Patrice, this is really great as I have goals to incorporate more trauma-informed care and body work. Doing lots of breath work with my body work has been helpful for my clients. This is so exciting. So, and Patrice follows up with, can this somehow be incorporated with trauma-informed care too? Or would that be something totally separate?
Oh, no, it's not totally separate. I mean, trauma-informed care just means there's a set of principles in how we deliver any approach, whether it's psychotherapy, whether it's body work, whether we're working as a physician, nurse. It doesn't matter what our healthcare work is. It's more a certain level of respect for our clients and how to help maintain safety and a sense of control for them. So that is absolutely how they're intertwined for me in terms of how this work is delivered. And I think a lot of body workers don't really realize that you know how you know this type of work isn't integrated into our massage therapy education so much, right? And yet I think from a continuing education perspective, anyone who's interested in moving in this direction, there's different approaches that incorporate some of these same things. I think that the work that I'm doing is probably unique in that it's really been designed for body workers. And it's very hands-on process that's very structured in terms of learning it and how to help your client learn take-home skills for themselves. So I'm glad you're learning about it and you're excited about it. So happy to answer any questions anybody else has too down the road. If you want to email me or call me, please feel free.
All right. And I wanted to ask a few questions as well. I got the feeling like you mostly work with adults. What about with children or autism or anything like that?
Yeah.
Are you working, does your work?
Yeah, no, great question. My work has been exclusively with adults. That being said, I've trained quite a lot of people who work with adolescents and in different disciplines, not just body workers, been occupational therapists, physical therapists, psychotherapists who work a lot with children, middle school, high school age, young adults. So, and they've really had to do absolutely nothing in terms of this approach being changed to sort of meet different the age ranges that they've been working with. So it's quite it's quite a simple approach. It's really about fundamental skill building for people. Excuse me. So it's pretty accessible to kids. As far as working with people who are neurodivergent, this work would be extremely applicable because often are challenges with sensory awareness, and this work is very much about developing sensory awareness. I personally haven't done it, but there are other people who are, whether they're using this approach or they're using another approach, but it's really about interoceptive awareness training still. There's a physical therapist who works almost exclusively, has written a book about the importance of interoception for autism and neurodivergent folks. So certainly that is absolutely a good point. And lots of other, I mean, honestly, it's good for all of us. This work is very helpful, I think, for no matter what you're dealing with, just being more emotionally regulated as a human being on the planet, as well as for specific conditions. I did see that Akai asked if my phone number and email are on my website. They are. When my email is actually right here on my with my face here, cynthiap@uw.edu. There's another email that is, if you go to the Center for Mindful Body Awareness, and Donnell will give you the link for that. It's also the link. The URL is on the front of the slides, which she's going to send out as well. So
yes. Yes. Patrice submitted something else. That's a great question, as I've wondered if something like this combined with trauma-informed care can help to stop the altering of children's brains after experiencing trauma.
Well, they may have more capacity to help themselves and not get stuck in some sort of automatic coping patterns that help them get through the trauma, but then aren't helpful later on. So I would imagine, yes, that it would lead to more resilience. Nobody's really tested that, but that would be my assumption.
Now, at the beginning as well of your presentation, you had referenced studies. Is that something that people would contact you for copies of? Can they find copies of these studies online?
Yeah, I did mention it. I'll mention it again. If you go to the website, the Center for Mindful Body Awareness, there's a tab at the top that says research, and there are links to every article. Some of them are research, some of them are more conceptual papers related to this work. So they're very easy to get. Yeah.
And you had also, thank you. And you had also mentioned that you hire therapists to be part of your research group. And if our audience is interested in that, they can email you or contact you through your website.
Absolutely. I mean, we don't, you have to have a brand new study to have the need to hire a therapist. Okay. I'm finishing one up. But so the opportunities to work on research are not huge. I think that what I'd like to see is opportunities for therapists to be hired into clinics whether there's substance use disorder clinics or whether, the VA is already hiring more body workers in their system, in chronic pain clinics, in clinics that are serving people who have mental health issues or anything, eating disorder. I would like to see body workers with these kind of skills being hired and incorporated into more conventional services. That's what I want to see. So, having the evidence base is really helpful for kind of moving the needle forward in that direction. So if any of you work in those kinds of environments and there is some interest in bringing some training in to promote this kind of integration of services, that I would be very happy to help with. So please do reach out if that's the case.
Well, wonderful. Thank you. And I had one last question because I thought I heard something somewhere over the last couple of months that you may be at ANTA National, or was it last year you were there, or somehow I heard you associated with.
No, I will be there in September at the AMTA convention in Florida. there's the MTA always has, I guess, a half a day program that they put on with the Massage Therapy Foundation that's more focused on research. And so I will be there with some of my colleagues, kind of reporting on some specific studies. That one of them is the one that just got completed with chronic pain and that they funded. And another one is just getting started, which is for people who are refugees in our country who have experienced a lot of violence. And that is a program that's happening in Minnesota. So we'll be talking about those programs and what we found, and we'd love to have any of you attend if you're free and available. It's going to be on the Friday of the AMTA, but I don't know what time. So yeah.
All right. Well, keep an eye out, everyone.
Yeah.
This might be a little far-fetched, but there are, and I won't use the brand name, but there are some weight loss drugs that can also help people with, or so I've heard, some of their other issues as well. Are you familiar with this? Like,
Mm-mm.
I don't know how, I didn't really want to mention the drug name, but it's in the world of diabetes. And it also helps manage like compulsive behavior or overspending or other habits that you have. Now, how would that fit in? How would working, because it's not substance abuse, it's a drug to help another problem, but it's also, from my understanding, working, it also has a side benefit of kind of minimizing some other behaviors.
Some behaviors or things people are struggling with. You know, I'm not familiar with that medication that you're talking about, or if I am, I'm not sure what one it is. But I'm sure that if it would be helpful for someone to have their own sort of ways of increasing their own capacity for emotion regulation combined with some medication that is also helpful to them, that would potentially be a benefit, but one would have to explore that further. I mean, right now, the study we're just finishing up on, everybody's on medication for opioid use disorder. It is an opioid, but it shuts off, you know, it's an antagonist in the brain, so it shuts off the feeling of being high, right? But you're taking a medication to help stabilize that sense of craving and the sense of being high, so you can kind of get your life back in order. So this work is being done as an adjunct in addition to that medication, right? Because even with that medication, it doesn't mean that someone's PTSD symptoms have gone away, or they're less depressed, or they're more able to emotionally regulate. They can more emotionally regulate just because they're healthier. But there's also still an enormous amount of mental health distress and pain that people are still living with. And so how do we help people give them some additional skills for managing those symptoms and increasing their capacity for self-care? So yeah, I think that this kind of work can be, along with other things, a lot.
I was thinking that it could fit in. I just wasn't sure how.
Yeah.
Akai also mentioned and I'm not sure if I'm pronouncing this right, nootropics, though it kind of stopped me from receiving the effects of nicotine, alcohol, and cannabis, to be honest. Any substances made is it nootropics react in a weird way. I'm not familiar with that, but.
Well, I think you're talking about just side effects to medications in general, and they all have something, right? So I assume that's what you're referring to, that he's referring to. Yeah. Yeah. Anything else people are interested in?
Well, in wrapping up, I'd like to remind people that to watch their inbox over the next, hopefully tomorrow, but it could be the following day, is a follow-up email that you will receive with Cynthia's PowerPoint presentation, her contact information, a QR code to subscribe to her free e-newsletter. And it will also have, did I say the recording link? I lost track of what my list of things coming in, a follow-up email. As well, for those of you who are not familiar, EduTalk Diabetes Series was launched in May. And for upcoming EduTalks next week on March 12th, from the massage community, we have Ruth Werner presenting on dialysis and kidney transplants. Does massage therapy have a role? And on March 19th, Dale Alexander, who's presented in EduTalk previously, will present on ancient reflexes, biomechanics, and the progressions of aging. For the diabetes talk, you can RSVP on ease-z.com, EASE-z.com, under the EduTalk tab for Ruth Werner's presentation next week. And you'll also, these will also be mentioned with links in the follow-up email tomorrow. And then Dale Alexander, invitations will be sent out. You can RSVP on biotone.com starting tomorrow. Thank you so much, everyone. Cynthia, anything in closing?
I just saw the chat that I think it was Patrice asked about volunteer opportunities in homeless shelters. Most homeless, there usually is an organization in any city that has some sort of way to volunteer. It's probably not the shelter itself oftentimes, but another organization. So we certainly do in Seattle, where I live. So if you're interested in that and you live here, I can help you get in touch with that, but I don't know where you are. But there's so many opportunities to practice what you do and be out there touching people and helping them feel better. So yeah, good luck with that. Yeah, no, please, if you're interested in anything, please don't hesitate to contact me. I do trainings in this work about once or twice a year, and not that often. But would love to have you here. And thank you so much for having this EduTalk and helping us get all connected to now. Appreciate it.
All right. Well, thank you for sharing such great information. And again, watch your inbox. If you do not find it in your inbox, check your junk mail as well. But this information, again, with Cynthia's recording, PowerPoint, contact information, and QR code for the free newsletter will be going out. So join us next week with Ruth Werner for the Diabetes EduTalk, and the following week with Dale Alexander for ancient reflexes, biomechanics, and the progressions of aging. Thank you so much, everyone. Thank you for your work. Be safe and join us again. Take care.
Bye-bye.
Bye.